The CDC has revised their mortality rate on COVID-19 from about 3 or 4% ish, where they were saying it was 10 times what it would be, 10 to 50 times or something more dangerous death rate wise than the influenza. Now they've revised that from 3 or 4% to 0.4% death rate with COVID-19.
Which I think is about, I did a show on this, and I think in February, because Trump was getting beat up about him saying, I think it's going to be less than 1%. I think we're going to find out it's going to be less than 1%. And he's getting hammered. Like, no, the World Health Organization says 3.4%. It's like, no, that's not what they said. When you looked at what they said, including all the scientists on this, they all were saying, we're not picking up millions and millions of cases. We don't think it's going to be anywhere near where it is now. But that takes time for it to come down, where you understand how far it's spread.
People can speculate.
That's what happens. It's just a very much unknown factor of a new virus. Like, very much known. Trump was completely right on this. All of his experts were saying it too, by the way. But the media said, no, look at this report from the World Health Organization, who is really just reporting the current rate. We only have discovered, for every 100 cases we've discovered, 3 people are dying, right? Well, there's a lot of cases they're not discovering. It might be 3 out of 1,000. That still would be worse than the flu. Right. But, it's a totally different scenario to prepare for, obviously.
And we probably first got a really good look at that from that Stanford study where they looked into Marin County and how many people had the antibodies as opposed to how many people had the virus and the estimates and all that. And it was 50 to 85 times higher, the number of people who were actually infected, which lowered the mortality rate by a factor of 10 or 100.
Yeah. And look, I've said on the air a bunch of times, I think I actually said 0.4 is what I think it's going to end up at. And the Lancet said 0.66. The initial, the Island Princess ship, which is a really good look at this because it's isolated. Like, there's no, where every case is, right? Mm-hmm. That turned out at a 0.8%. Mortality rate. However, because it's a cruise, more older people, there was reasons why it was a little higher, but it was a good sense to make sure that it was going to be a good sense that it was going to wind up being less than 1%. The other part of this, though, is when you talk about that study, which does show that the fatality rate is going to be less, this idea that we're somewhat close to herd immunity it does not seem to be being proved out at all. Even the study you're talking about, which did say, it was 50 times as many people had it than they had tests for, also said the high number of people in the county was 5.6%. It was like 2.8 to 5.6% was their range of people who had it already. So the highest number anywhere in the country was New York City, which was 19.9%. So we're nowhere near. They think it's like 4% of the country has had this so far, something like that, which is still a huge number and does lower the mortality rate considerably. But it is not something where we are like, 80% of people have had it, so we're going to be fine. No one else.
Which you kind of wish it were that way.
That's what you want. It's one of those things where I wish I had that disease. It's a weird thing to say.
Yeah.
But I know we've had people here who've done the antibody tests, which are now much more widely available than they were previously. And you go in there rooting for the idea that you actually had COVID-19. Because now you've survived it. It would be over, and now you can go do whatever you want, in theory, because of the immunity, which does seem to be proved out. That's another piece of good news we had last week.
That you do have some immunity.
It does. They don't know how much. They don't know for how long.
Yeah.
But most of that has been speculation. I've heard Fauci say this in his testimony where he says, we do believe it will give you immunity, but we don't have the final confirmed test results of that yet. We believe it because we've watched every other virus and how it acts, so we believe it's going to react the same way, but we don't have it confirmed yet. The first confirmations really started trickling in last week where they found there is some level of immunity for some time. It just depends on how long that is and what does that mean? Like, immunity doesn't always mean you don't get it. A lot of times it means it's just a lot more manageable. Like, you might get
a milder case
it might be much more mild, and it's not that big of a deal. Either one of those is a good outcome.
Yeah.
We just don't want. I've had enough of this thing. I want it out of my face.
Yes.
I really do. I would love to move on to something else.
But this week, maybe even today, we're going to hit 100,000 deaths. And when that happens, you're going to get parades from the mainstream media. They're going to do ticker tape parades. Yes.
That sounds irresponsible.
Dancing elephants.
Really?
I mean, yes. Ticker tape. Lion trainers. It's all of it. The whole circus is going to be brought out for us when it hits 100,000. They love to talk about the amount of deaths that there have been, because then they pin it all back to Donald Trump and blame it on him.
Obviously ridiculous. Of course, that's what they're going to do. Yeah. I don't know if the American people are going to do that.
No.
Some will.
The mainstream media will do that.
So many people have their minds made up on Trump, and it does seem that the people who hate him are blaming him for everything. People who love him are blaming him for nothing. So I think there's, I don't think the response has been perfect from anybody. Governors, the president, the CDC, I think, has had major missteps throughout this.
Yeah, huge.
But that being said, it's a difficult situation to deal with.
It is.
It's not easy.
But then you got people blatantly removing the blame from themselves and then placing it on the president, like Andrew Cuomo.
Oh, he's the worst.
With the nursing home thing. He's trying to depoliticize it by saying that he was following the federal guidelines from the Trump administration. No, he signed an executive order that sent COVID-19 patients to nursing homes.
Yeah, guaranteed they would be admitted with COVID-19 positive. And also, the other part of that, which doesn't get as much attention, is that he prohibited nursing homes from testing patients for COVID-19 if they weren't showing symptoms. So, if you wanted to say, okay, we're bringing in 5 new people, let's make sure they don't have COVID before we get them started here, right? Totally sensible thing, responsible thing to do. And they said, you can't do that. You're prohibited from doing it.
You couldn't have done a worse job if you were trying to kill people.
Well, I honestly ask you this question. If you were to design a policy which had a goal of killing as many people in nursing homes as you could.
Which was 5,000, by the way.
Would you? And it's much more than that, by the way.
Probably more.
It's 5,000 confirmed, but they are not. They did this thing where they were taking people who were in nursing homes, got sick, went to the hospital, died at the hospital. They weren't counting them as nursing home deaths.
Oh, wow.
Which is infuriating. Infuriating. Wow. I mean, so it's probably at least another 5,000 because they're probably around like everywhere else is. It's about between 40 and 60% of deaths throughout states are from nursing homes. It's a big part of this, the biggest part of this.
Yeah.
And, if you were to design a policy where you're like, you know what? These old people are a real problem. They're draining our resources. They've already done that whole, Soylent Green thing, so we can't really go down that road. What should we do? Would you change a bit of Andrew Cuomo's strategy if that was your goal?
No.
You would say, what? Don't test people coming in.
No, right.
And if they have it, make them go back inside the nursing home. That should kill all the old people.
Absolutely bizarre.
It seems as if it was designed for the purpose. That's how bad of a policy it is.